Hey there, this is Dr. Evan Osar, developer of the Integrative Movement System. Welcome to video 2 of this 3-part video series on training older clients, especially those clients that have spinal conditions such as degenerative joint disease and or spinal stenosis. Recall from video 1 that when we're training clients with these spinal conditions, we're not focused so much on the condition once they've been medically cleared to exercise. However, we do want to educate ourselves about these conditions so that we're in the best place to work with these individuals. Our primary focus when training clients, whether they have disc problems, whether they have arthritic problems, whether they have spinal stenosis type issues, is we truly want them to get long through their spine and or suspend. Many of our clients, many of us, as we go through life, we get overcompressed because of gravity, because of muscle contraction and too much bracing, because of rigidity, because of poor breathing habits, and it really starts to compress down on the low back. So we really want to teach our clients how to suspend or get off their low back, and we do that through aligning, breathing, controlling, teaching people how to create this idea of opening or suspending. The next part of our strategy with working with clients that have spinal conditions is really teaching them how to use their hips. And one of our go-to patterns for helping our clients to use their hips is the hip hinge pattern. Many of our older clients don't have a good ability to move their pelvis over top their femoral heads or to move into anterior pelvic tilt because of tightness in their posterior hips, because of tightness in their hamstrings, because of poor awareness. So the hip hinge pattern is one of those best, or one of our go-to patterns for improving their ability to use their hips appropriately and ultimately to spare their spine or to stop using their spine for most of their motion. A lot of our clients will start out with a supported version. So what we have them do is think about their long spine alignment as if they're being pulled towards the ceiling. They stack the rib cage over top their pelvis. They'll hang onto a bar or place their hands on the bar or up against the wall. And what we teach them to do is we really want them to hinge or rotate that pelvis anteriorly over top their femoral heads as they go forward, and then come back up tall without squeezing, gripping, and over tightening the posterior hip on their way up. So they'll take a deep breath in this position, stay long through the spine as they go through their hip hinge pattern, spread the sit bones, move that pelvis anteriorly as they move forward, and then come back up tall. So breathing in, and then breathing out as they sit back in their hips, focusing on releasing through the posterior hip, releasing through the hamstrings, and getting that pelvis to move anteriorly. Because that's ultimately what we want our clients to do when they do any type of chopping patterns or bending patterns. The next progression, once they learn that movement, is to place their hands on their pelvis so that they can actually monitor and feel their own movement of their pelvis. So we teach them again, same idea. Long spine, stack that thoracolpelvic cylinder. Hands on the pelvis, move that pelvis anteriorly up and over top their femoral heads. And of course we don't use those words, we just say move that pelvis or rotate that pelvis over top your hips and then come back up tall. And when done properly, they should feel stretching or opening in their hamstrings and posterior hip with nothing in their low back, and their spine should stay long. So they're breathing out and then breathing in to come back up tall without over gripping and pulling themselves into posterior tilt. And only when they mastered that exercise pattern do we teach them how to load that pattern with medicine ball, dumbbells, kettlebells, and or barbell. So this is Dr. Evan Osar, Integrative Movement Insider. I hope this video helped you understand one way to start to work with your clients, an important way to get them using their hips so that they're not overloading their spine, especially those older clients that have degenerative and arthritic changes in their spine. In video 3 of this 3-part series, we'll look at how do we start to talk about or work with clients with rotation. How do we use core patterns? How do we use and train core patterns with rotation, especially in those clients that have arthritic conditions. Thanks for watching. We'll catch you next time. We're going to be in several locations starting this February, bringing the Integrative Corrective Exercise Instructor program regarding training the older adult. And this program is very specific to those of you that work with older clients like we do. We're going to be sharing with you the assessments and the corrective exercise strategies, the strategies for success that we use with our own general population clients, especially those older adults. will teach you how to take these concepts and integrate them into the fundamental movement patterns that you're already using with success with your own older adult clients. So you become that specialist they need, they want, and your potential clients will seek out to help them successfully achieve their specific health and fitness goals. So if you're looking for more information, click on the link below, and I'll see you in videos 2 and 3. Take care.